Okay, Chair, we're now live streaming. Thank you.
Thank you, Nathan. Bore da pawb, croeso cynnes iawn I chi gyd. Good morning, everybody, and a warm welcome to you all to the annual general meeting for Cardiff and Vale University Health Board, covering the financial year ending 31st of March 2025. I've had apologies this morning from Catherine Phillips, Paul Bostock, Susan Lloyd-Selby, and Joe Brandon. And a warm welcome to today's meeting, if I may, to Rob Marney, Adam Wright, and Chris Winter-Jones. Are there any declarations of interest, please? Okay, thank you. If I may, I'd like to say a few words before we get into the main agenda. And firstly, I'd like to, on behalf of my board colleagues and myself, it's a pleasure to have you with us as we reflect on the past 12 months of activity across the Health Board. It's been a very busy year, as you can imagine. My name is Charles Janchevsky, although to most people I'm known as Jan. I have the privilege and the honour to be chair of Cardiff and Vale University Health Board. But sadly for me, having been in post for the last 8 years, my term of office comes to an end shortly, and a new chair has been appointed and will take office from the 1st of October 2025. And most of us will have seen that the appointment is Kirsty Williams, and a warm congratulations to Kirsty on her appointment. I'd like to briefly acknowledge, if I may, the various opportunities I've had in this role to engage with so many of you. My sincere and heartfelt gratitude to our amazing staff. They're simply first class, and it's been an absolute joy to meet so many of them over the last 8 years. They work tirelessly across the Health Board, whether that be in our community-based services, acute hospital settings, or our wide range of mental health services. They are so dedicated and caring. They've been magnificent in their endeavours to always provide high quality and compassionate care to our patients and their families, both within our area and for those people from outside of our immediate region who require the more specialised services that we provide here in Cardiff and the Vale. I also wish to acknowledge, if I may, the excellent partnership working that I've been very pleased to be a part of during the last 12 months. Perhaps I could pay tribute to the various stakeholders I've worked with, from the Regional Partnership Board, the Public Service Boards, Cardiff University, and colleagues from Health and Social Care across the local authorities and third sectors in Cardiff and the Vale of Glamorgan. It's also been very rewarding to work closely with colleagues from Welsh Government and with the local members of the Senedd and members of Parliament who represent their constituents in the communities that we serve. Collaborative relationships have undoubtedly supported the delivery of many strategic initiatives and aided the progress of the Health Board shaping our future wellbeing strategy, an ambition which could not have been achieved in isolation. I'm so proud and so pleased to have the opportunity to work alongside you all. I continue to be humbled and inspired by the great work you do. Thank you, diolch. On with today's agenda, and a warm welcome made to my executive colleagues who will be sharing with you some of the progress that has been made in their respective portfolios of work, including a range of updates across performance, finance, infrastructure and governance. For those of you who are unable to join us today, the video recording of this meeting will be made available on our website very shortly, which can be viewed when convenient. I'd like to begin by acknowledging the several changes to our board membership over the last 12 months. Sadly, we said farewell to a couple of colleagues, Akmal Hanuk, who was the independent member of community who left us at the end of March, and Marie Davis, who was the interim executive director of strategic planning, who left us on the 31st of January. I'm very grateful to them both for their very full support and the contribution they made during their time with our Health Board. We welcomed in the same period Dr. David Fluck to the executive team as the Executive Medical Director, and David joined us in October 2024. In the meantime, a big thank you, if I may, to Dr. Richard Scone, who did an incredible job taking on the Medical Director role on an interim basis, covering the period April until October 2024. Finally, we also welcomed 2 new members to the board. Firstly, Professor Steve Riley in October 2024, independent member representing universities, and Dr. Rashna Apadia at the start of January 2025, who is fulfilling a generic board role. Since we last met at the previous AGM, we have seen further transformation across primary, secondary and tertiary care. I'm pleased to confirm that the Health Board has continued to make good progress with the implementation of our refreshed strategy, shaping our future well-being. Much of which will be highlighted in our year in review video, which is coming up shortly, so I won't go into too much detail here. As you'll be aware, the strategy is guided through our 4 key strategic objectives of putting people first, providing outstanding quality, delivering in the right places, and acting for the future. Given the sheer scale and diversity of the organisation, there have also been several challenges to navigate during the year, which my colleagues will talk to later in this presentation. Despite the adversities we inevitably face, I'm genuinely inspired by the commitment, compassion and dedication of our staff, who always go to such great lengths to care for our patients, both within our hospitals and our communities. A special mention as well, if I may, to our charities fundraising team, who with your support tirelessly continue to raise money, which pays for those items and activities above and beyond NHS expenditure, including additional patient comforts, music therapy, and staff wellbeing initiatives. Never has a charity been more important in helping deliver the very best care and experiences for our patients and our staff. Llongyfarchiadau, congratulations, and thank you. Moving on with the agenda, I'd now like to move over, if I may, to my colleague and Chief Executive Officer, Suzanne Rankin, who will take us through the annual report and annual quality reports for 24-25. Suzanne.
Diolch, Jan. Bore da pawb, good morning everybody. Thank you to everyone for joining us today and providing my team and I with the opportunity to share with you the progress that we have made across the last 12 months towards the achievement of our annual plan and our Shaping Our Future Wellbeing strategy. My name is Suzanne Rankin and I am very honoured and privileged to be the Chief Executive Officer for Cardiff and Vale University Health Board, and with the support of a wide range of stakeholders and the communities we serve, our emphasis over the past year has continued to be on ensuring that quality and value underpin our entire approach. Despite a very challenging year for the Health Board, we have made progress and improvements across primary, secondary and tertiary services, which absolutely could not have been possible without the dedication of our colleagues who continue to provide compassionate care to patients and their loved ones and citizens right across our communities and within our hospitals. I will be reflecting on some of the many positive achievements that we are proud of, but it is important also to reflect upon some of the very significant challenges where we have failed to meet our ambitions or failed indeed to meet our statutory duties. And I will come to a deeper reflection on those elements later in my presentation. Next slide, please. I can't see the slides moving.
Bear with me, Suzanne. They should come back on.
Okay. If we can go to the strategic objectives slide, Nathan, that would be helpful. I'll make a start and we'll hopefully the slide will catch up. So as part of our routine annual planning cycle, we regularly review the service priorities of the organisation to ensure they align to our 4 high-level strategic objectives featured in the long-term 10-year strategy, Shaping Our Future Wellbeing. Colleagues will know that our vision is to improve lives so that by 2035, everyone has an equal chance of leading a healthy life, regardless of where they live or who they are. And in order to achieve this, we have established strategic portfolios of work to ensure that we have plans to effectively deliver this strategy and we have co-produced a set of strategic shifts in order to guide our next steps. These shifts will support the organisation from a transition on the traditional emphasis of illness and injury to really focusing on delivery of equitable health and well-being and ensuring consistent quality and outcomes. We will look to move from being analogue buildings, if you like, to being digitally connected places and people, and planning for sustainability. Putting people first speaks to an ambition for us to be a great place to train, work and live, where we will listen to and empower people to live healthy lives. We hope that by 2035, colleagues would recommend us as a great place to work, and that our workforce and colleagues will reflect the diversity of our communities, and more people will be living healthier lives. Providing outstanding quality speaks to the need to provide outstanding services which are equitable, timely and safe, and where people are treated with kindness and compassion and are supported to achieve the outcomes that really matter to them. We will look to reduce inequalities in prevention and outcome by the use of prevention and in outcomes, and improve access to clinical services and outcomes. We're dedicated to fulfilling our statutory duties of quality and candour, whilst at the same time drawing on the many levers we have to deliver this ambition. By 2035, we will be hoping to be using real-time integrated data to inform joint decision-making and multidisciplinary team working, giving people access to and ownership of their data to enable them to be in charge of their own healthcare and in charge of their decision-making. And we will be well on our journey to provide care in the right places in facilities that are fit for purpose, flexible and promote recovery. And finally, but by no means not importantly, our strategic objective, Acting for the Future, describes the work we will do to ensure that what we do today does not compromise the well-being of future generations. We will seek to protect the environment and develop and use new technologies, treatments and techniques to provide the very best possible health outcomes and sustainable health and care into the future. By 2030, we will have reduced the Health Board's carbon footprint, and we will have increased our research and clinical and innovation activities. Next slide. This slide depicts the service priorities that, if you like, organise the way we prioritise our work across our organisation. And it speaks to an approach to time sensitivity and urgency of care and treatment. So our first priority is that patients in need of urgent and emergency services receive timely access to the important care that they need in a very short time frame. We then look to ensure that patients who require time-sensitive care, such as cancer care, are able to access that appropriately. And then we look to ensure that patients needing more routine care or elective services are able to do so in a timely way that doesn't deteriorate their position whilst they're waiting. And you will see that our outcomes and activities have delivered on those priorities. But in some ways that does present a challenge in terms of achieving the right level of balance across those priorities. And that was something we will continue to reflect on as we work together this year and into the future. Next slide, please. So here is a slide that picks out some of the moments that we should be absolutely proud of. The work we've been doing in urgent emergency care to support our colleagues in the ambulance sector to respond to patients in the community rapidly and effectively has continued apace. And we continue to be a good performer in relation to the rest of Wales when it comes to things like ambulance handover, which is very important. But of course, it is also a challenge to sustain that performance. And we have found that in some elements of the urgent emergency care pathway, we haven't made or sustained all of the improvements we would wish to do so. So we will continue that work with a very detailed focus on what is the appropriate flow across our organisation in order to achieve that. There is more work to do. With regard to hip fractures, for many people, especially our older, frail individuals, a hip fracture is a life-changing event that can result in a prolonged hospitalisation and huge loss of independence. Over the last few years, we have been working across the Health Board and with our trauma and orthopaedic colleagues to implement radical changes in their treatment pathways, resulting in a quicker and more effective service for hip fractures. And when it comes to the delivery of cancer care, we've worked really hard, as I described, in terms of an alignment with our strategic priorities and our service priorities to ensure that as far as possible, patients begin their treatment within 62 days of referral. We've set ourselves an appropriately stiff ambition in this regard, and whilst we have not always achieved it, we are well ahead of our trajectory, and for the majority of the year have done so, and achieved over 70% in the performance in both September and October. And I'll just draw your attention to the picture on the screen. So the lady on the right-hand side of the screen is a lady called Susan Clark. And Susan has benefited from our Safe at Home programme, which launched at the start of 2024 and has gone from strength to strength. This programme seeks to provide rapid and enabling care in a patient's home to avoid any conveyance to hospital and to ensure that they are safe and well at home, just as it says on the tin. Thus far, this service is estimated to have avoided over 7,000 bed days by providing multidisciplinary support to patients in the community. Next slide, please. Next slide, please. So with regard to the strategic objectives, I'll take us through a set of achievements that we've made in each of these areas, which, as I described, is a product of the work of the strategic portfolios and, of course, of our clinical boards, the frontline teams and those who support them. So in terms of putting people first, what you can see is a picture of a colleague from the hospital palliative care team who have introduced a programme called Every Moment Matters. Now, we know how important compassionate and respectful and dignified end-of-life care is for patients and their loved ones. And so this programme seeks to help create a calmer and more peaceful environment in hospital during this very challenging time. Every Moment Matters is an initiative which is designed to enhance dignity and respect for patients in their last days of life. And as part of this, the team have created a new symbol which will be introduced across our clinical areas to raise awareness for patients and other visitors with obviously the consent of that family and the patient, to indicate what a difficult time the family are going through and to ensure that others are sensitive to it. Our Vaccination Saves Lives programme has been recently recognised twice for excellence at the Vaccination Saves Lives Awards, and the team award was given to Cardiff and Vale Public Health Team, and the Vaccination for Colleagues for their outstanding partnership with Cardiff Council and Vale of Glamorgan Council, while the Champion Award was given to Cardiff and Vale University Health Board's healthcare assistant Julie Morgan. So a great example of work within teams within the organisation, but also of work with partners across our system. Health Heroes, we're very proud of the compassion, dedication and talent our staff demonstrate every day to provide exceptional care and support. Their hard work and commitment makes a meaningful difference to patients, families and communities across Wales. The Health Hero Award, which is sponsored by Park Plaza, allows patients to nominate extraordinary individuals and celebrate their work to go the extra mile. We've launched a collaborative pilot involving health and third sector organisations within the emergency unit at the University of Hospital of Wales to reduce the harm from alcohol that occurs across our geography. The alcohol screening project screens all patients who present to the emergency unit to understand their level of alcohol risk, with the aim to identify and support those at risk of alcohol-related harm. And as I've described, more work is going in to support patients and families at their end of life. And in addition to the Every Moment Matters programme, we're working with Marie Curie to improve that service through a hospital companion volunteers service, which provides that additional hand of kindness and support. Next slide, please. So the achievements are extensive in relation to providing outstanding quality, and many of those achievements will have been seen in the BBC Saving Lives documentary. The second season aired, I think, just recently, which showcased how surgical teams are working hard to put people, to create the opportunity for people to access high quality 21st century surgical intervention against a significant backdrop of long waiting times and challenges with capacity. I think the programme really demonstrated that very real life challenge that our colleagues and teams have every day as they're thinking about how to organise their work. I identified the impact that work has on patients and their families, and provided a fantastic platform for members of the public who wouldn't normally get to have that level of access to see how that all works, some of the challenges and some of the positive impacts. So my thanks to the BBC for working with us on that, and to all of those who contributed, whether they be surgeons, anaesthetists, members of the perioperative or wider team, as well as patients and their families. Next slide, please. One of the pieces of work that we are working on this year and begun through last year is something we're terming Brilliant Basics, which fundamentally speaks to ensuring that we do the fundamentals in the right way, at the right pace, and with the right support. And we need to put the right systems and processes in place to support that. Each of the strategic portfolios that I've mentioned have identified their Brilliant Basics priorities and associated key performance indicators, so that we can be clear the progress that we're making and track towards that sustainable future we're all seeking. We've got 4 wards that have achieved bronze accreditation status in the ward accreditation programme. And this creates the opportunity for teams to celebrate their successes, but also to see how they measure up against one another. Always useful to create a little bit of gentle competition to drive improvement. Several colleagues have been recognised this year for their dedication in the delivery of outstanding care, and pictured on the screen is Madeline Watkins, the Royal College Nurse of the Year. Madeline is a clinical nurse specialist for psychosis in older adults, and she was named at the ceremony in 2024, where the chair and I had the privilege to be present, and it was an absolute joy to see her surprise and humility in the face of such a great achievement. There was a number of other colleagues identified and nominated within those awards: Lisa Franklin, Tim Nichols, Julia Summerford, Kim Baker, Jade Cole and Diana Merez were all recognised, as I say, for their outstanding commitment to quality. There have been many other colleagues identified and nominated for achievements. MBEs were awarded to consultant physician Dr. Hamzara Shetty for his services to stroke care, and Professor Anthony Johansson, consultant orthogeriatrician, for his services to older people. At the UK's Advancing Healthcare Awards, the All Wales Nutrition and Dietetic Lead for Diabetes, Catherine Washbrook Davis, was awarded for maximising expertise to improve patient outcomes, and Helen Nichols, now retired Head of Nutrition and Dietetic Services, won the Clinical Leadership Award. The Supportive Care Team won the Sir Mansell Alwood Person-Centred Award at the NHS Wales Awards 2024 for broadening access to end-of-life care and putting patients at the centre of decisions. And Rhianne Greenslade, the Well Child Discharge Liaison Nurse for children with complex health needs at the Noah's Ark Children's Hospital for Wales, was named as a winner in the prestigious National 2024 Well Child Awards. I'm sure colleagues will join with me in celebrating the achievements of those colleagues and of many others that time doesn't allow us to speak to or share with you today. And despite the many challenges that we've reflected on and will further do so as this presentation proceeds, it is important to celebrate the work of colleagues and recognise that despite everything, they are still able to create the momentum, the inspiration and the energy to achieve these sorts of national recognition. So my thanks to them. Next slide, please. The Cardiff and Vale University Health Board's National Organ Retrieval Service, known as NORS, led by Al Cruz, is an award-winning group recognised for its innovative use of normothermic regional perfusion in organ retrieval. This pioneering technique has allowed the team to successfully retrieve and transplant organs, including livers initially declined due to poor function, saving many more lives. The team's dedication and innovative approach have received national recognition for excellence in organ and tissue retrieval. And I've had the pleasure of meeting this team and Al Cruz, and have to say, very humbling and inspirational that was too. You've heard us talk before about the CAVIS programme, which is the Cardiff and Vale Inclusion Service. This year we've launched the Outreach Service, which is an expansion of the service working in partnership with local authority colleagues. And this provides the opportunity to identify patients from that community in our emergency unit and provide intensive wraparound support to them. Data was shared very recently that indicated a big improvement in the access of services by those patients, but also of their length of stay and frequency of attendance at the EU department. So very positive signs on that work. As many colleagues will know, the cardiothoracic services have been relocated back to University Hospital Wales. That's easy to say on a slide, very difficult to deliver in reality, a great deal of complexity and partnership working right across the health board to achieve that. And as I've said, the rapid hip fracture pathway is really making a big difference to patients who present with hip fracture. And it means that they will get rapid access, as I've described, to the appropriate bed and expertise, which is really good and important to see. Next slide, please. Delivering in the right. Next slide, please. Achievements in this regard. So we continue to work to adapt our services to meet patients' needs and promote the recovery. I've already spoken about Safe at Home, so I won't repeat that. But we have also built on the success of what is known as the Hangout in Cardiff. We have opened a second facility in Barry, which provides a welcoming and relaxed environment for 11 to 18-year-olds to access mental health and emotional well-being and support. And in addition, opened the Serbian Sanctuary, which is Cardiff and Vale's first non-clinical community-based mental health crisis facility, offering a safe space for individuals experiencing a mental health crisis or needing support. This service is run by Platform, a mental health and social justice charity that we've done an awful lot of partnership working with, and my thanks to them. And this is important because this indicates the shift that so many talk of and is difficult to achieve, where services are moving out of a hospital or services are provided in a community, which means hospital attendance is not necessary. And not only does it provide that care closer to people and their communities, but actually the evidence is that the care quality is better in that regard. It meets the patient's needs in a more wholesome way and delivers better outcomes. We've also opened 2 new endoscopy theatres within the unit at the University Hospital of Languedoc, and this is part of our recovery programme in relation to planned care following the pandemic. And this expansion supports the national programme for improving endoscopy services, enabling a more patient-centred care and increasing the number of procedures performed annually, and of course, and importantly, to improve access and reduce waiting lists. And lastly on this slide, which is important to just dwell a moment on, the Healthy Lives event, which took place during Ramadan. The event provided an opportunity to educate women of Islamic faith, give them the chance to find out more about breast, cervical and bowel screening, as well as childhood immunisations. And this is because we know that the communities, such as the Muslim community, have inequitable access to care and inequitable outcomes in those pathways of care. And it is not simply enough to say that you will equalise that opportunity. Targeted intervention has to be made to create opportunities for those communities to access these kinds of care. I had a very interesting conversation with a GP at the weekend who told me a great deal about the work she was doing in one of our communities in Cardiff in exactly this space. And a great deal of fundamental education is actually required to enable those members of our community to make decisions for themselves and to make a decision to access care in this way. So that was a really important event. Next slide, please. Next slide, please. Acting for the future, as I've said, is really about ensuring that we fulfil our statutory duties with regard to the Future Generations Act, for example, but also in ensuring that we behave in a sustainable way and that we don't further impair the environment. So what you can see on the slide here is the critical care team at the University Hospital of Wales, which have been supported by the Shaping Change team, winning an award for their Gloves Off campaign, which encourages staff to be more deliberate about their use of disposable plastic gloves, wearing them only as risk indicates, not as a sort of standard practice. The Green team, the Green ITU team, I should say, has featured in a recent production of a sustainability guide and featured heavily, I will say, in terms of the case study examples of their work to reduce waste and conserve energy and make financial savings. I think what we are learning is that if a practice is considered green and sustainable in that regard, it very often also delivers the best quality of care and improves our work in relation to our decarbonisation project. And the Green team have been really at the forefront of identifying opportunities to deliver clinical care in a green and sustainable way. And last but not least, I want to talk about the electronic prescribing and medicines administration solution, which has been recently launched in the Health Board, working in collaboration and partnership with Welsh Government colleagues and others. This is a really important initiative that takes us along our journey towards an electronic healthcare record and will start to create the opportunity for safer prescribing of medicines, a more effective administration of medicines, as well as securing records and data associated with that activity. It's a complicated programme to launch, but it's an important part of our journey that I described at the beginning to become a digital environment. And I should speak to the use of AI technology that has been deployed in the diagnosis of stroke patients, a pioneering app called Brainio Mix, which can now be used to scan patient images and present clinicians with a quick and detailed graphical display, allowing them to interpret brain scans and decide whether or not to perform a thrombectomy, which involves removing the blood clot mechanically, or whether the patient would benefit from clot busting drugs known as thrombolysis. The piece here is this speed. Speed of diagnosis of a stroke is absolutely critical, as you will all know, in terms of delivering the right intervention and achieving the best possible outcome. And so the deployment of this AI technology is supporting our speed. Now, I've spent a lot of time talking about achievements and celebrating, and I think we do have to reflect on the challenges. So some of these challenges described on the slide really set context for the challenges and might help explain why we have failed, for example, to meet our financial duties, or where we have struggled to deliver our ministerial priorities in the planned care and diagnostic arena, particularly. Yes, our population has grown rapidly in Cardiff. Particularly, we've seen a growth in the population of working age adults, which looks to be as a result of immigration, the national policy around nation of sanctuary and so on. And obviously, we've already spoken about the CAVIS service. Patients coming or population or citizens coming from other parts of the world often have unique challenges and particular health needs, and that does create demand. And I think we've shown in the presentation where we've sought to meet that demand in a very specific and sensitive way. But it creates a demand and pull across all of our services. So that will continue to be a challenge, as we expect that whilst the growth has slowed, that the population will continue to grow. You will know that we have an aging population, many of whom now have a number of long-term conditions. Nearly a third of people are reported to have one or more illness, which is a very concerning statistic. And the number of those with type 2 diabetes, for example, is forecasted to continue to increase over the coming decades. So this presents us with a health board with many challenges and complexity, and it will also draw our attention and resources to attending to the needs of the population today. And what we need to be able to do is focus the balance across today, ensuring that patients have timely access to diagnostic and planned care and emergency care as they need it. And for us, very importantly, specialist services for those who have a very particular need that needs a level of expertise and infrastructure that can be supported by a tertiary hospital. But it can also create a drag on our attention to the things that we will know will make sustainable change into the future: preventative care, bringing care into the communities, the deployment of technologies. So these are very real and present challenges, and I feel confident that the board and our teams work hard to balance those things. But we are seeing a continued challenge to the inequalities and deepening inequalities in our communities, which is a concern. If you live in one of the most deprived parts of our geography, you can expect to live 8.3 years longer as a woman, or 9.3 years longer as a man in comparison to someone living in the most deprived areas. And that is not right. And I think we have to pay close attention to that and ensure that all that we are doing seeks to address that inequality in outcome. And hopefully I have given colleagues on the call some sense of the work we are doing to address that. The financial position has been extremely challenging, and last year we failed to meet our statutory duty to deliver a balanced plan, and we had to reforecast our position, and that was extremely disappointing. And we were subsequently escalated into targeted intervention, which I think we understood and to some extent expected. As we stand here today, there has been a further expansion of the scope of the Health Board's escalation status of targeted intervention. And it is really disappointing to find ourselves in this position. I do absolutely acknowledge that status and the factors contributing to it, alongside my accountabilities and those of the wider board. And what I will say at this point is that we are firmly committed and working incredibly hard to address that issue during the course of this year and into next, and to recover the position of the Health Board. There's a more detailed presentation, as you will see from the agenda, in relation to our financial position to follow. Next slide, please. Some of the work that we've been doing is to strengthen delivery of our strategy. I'm not going to go through all these slides, but just to give a sense of confidence that in all of these areas, in terms of regional working, the ensuring that we deliver productive and effective acute care, that we seek to deliver contemporary mental health services that are collaborative and delivered in partnership with service users, strengthening of primary and community care so that we can make that step to what is known as the shift to the left, but really speaks to ensuring that people and communities access care as close as home to possible, and care that delivers the opportunity for promotion of independence and well-being, and a focus, as I've described, on some really key elements of public health, such as smoking cessation, weight management and addressing obesity, ensuring that our immunisation rates are where they need to be to protect the population. All of these things, in addition to what I've described, continue to be very important elements of work last year and into this year. Next slide, please. So just to give you a sense of the coming year's priorities, and each of these priorities is articulated in relation to a strategic objective. So in terms of delivering outstanding quality, we will absolutely have a laser focus on eradicating avoidable harm. This speaks to delays in a care pathway, infection prevention control, various variability in practice, and a whole range of things that I have already described in relation to brilliant basics. So huge amount to do in that arena. I'll come on to a specific later. We need to continue to do the work that we have done around the population needs assessment in order to ensure that we understand what the population needs in a detailed way, and where we can understand the opportunities to, as I've described, address the inequalities that we see and bring care and targeted intervention to the communities that need it in the right way. We will continue to digitally invest to enable transformation and to prioritise our estates in infrastructure improvements. And clearly, as I've already described, a continued focus on driving financial sustainability and value through all that we do, including the delivery of the decarbonisation plan. We've also got work that we're seeking to do, working in partnership with others, to ensure that we can create the environment within which we can deliver world-class clinical research and innovation. And we are working on a prospectus as we speak to describe what that will look like, how the partnership will operate and what it will intend to deliver, but it will absolutely capitalise on the opportunities that we've got, and where we've been working with the Genomics Partnership for Wales and the Advanced Therapies Programme. In addition, we need to deliver, as I've said, our current financial plan and our forecast in this financial year. We need to improve that position and to reduce our deficit and deliver the control target. That will take a lot of work and focus, but I'm committed with my colleagues to do that. We will focus on delivering the Cabinet Secretary priorities and the recently announced Improving Together programme, and really importantly, and particularly in relation to practice, culture and safety, we need to continue the work on the rapid improvement of our theatres at University Hospital Wales, but also across all of our organisation through our Theatres Together programme. I'll conclude there, Chair, because we've got other presentations which will add value and information to what I've already said. Thank you, Chair. Thank you, Board.
Thank you very much, Suzanne, for a very comprehensive presentation, but I suspect it barely scratches the surface of the absolute wide range and complexity of the work undertaken by the Health Board, but thank you for that. I'm going to move us through now to the next item on the agenda, which is the financial accounts for 2024-25, and Rob Marney is going to lead us through this section. Over to you, Rob, please. Are you there, Rob? Are you there, Rob? Are you on mute, perhaps?
Hi, Chair, it's Adam here. I've just had a message from Rob that I think he's his screen has gone off. So I think he's trying to log back in. Apologies.
Thank you, Adam. We'll hold fire for a minute or two. Hope that Rob can rejoin us.
Hello, can you hear me?
Hello, is that you, Rob?
Yes, sorry, I'm having a little difficulty here. Hold on.
Are you ready to start your presentation? We can't hear you, Rob.
Sorry, I'm back in now, Chair. Thank you. Sorry, I had some technical difficulties. Can you hear me now?
We can. Can you press on, please, Rob?
Yes, please. Right. Thank you. Okay. Suzanne has talked a little bit about the financial position we found ourselves in. Just to remind all that we have two statutory duties, base duties as a health board. One is to ensure that we do not spend more over a 3-year period than the allocations and the funding that is allocated to us as a health board. So that's balanced over a 3-year period. So we can overspend in some years as long as that is balanced by underspends in others. It's a 3-year aggregate. And we have a duty to prepare and obtain approval from the Welsh Government for a plan which achieves the 3-year rolling position, i.e. an approved roll-in IMTP plan. Next slide, please. So in 24-25, we were unable to submit a balanced 3-year plan to the Welsh Government based on the forecast for 24-25, but also the previous financial years, which meant that there was no possibility for us to achieve an underspend that would have balanced off the overspends of previous years. And as a result, we couldn't meet that statutory duty to have an approved financial plan. And until a balanced 3-year integrated medium-term plan can be submitted, Welsh Government placed a requirement on the Health Board to submit a 1-year operational plan. That is the alternative if we cannot submit a 3-year balanced plan. So we submitted a 1-year plan. The figures changed a little bit during the year. We had to flex some of the forecasts, but eventually the 1-year operational plan that was recognised by Welsh Government had a planned deficit of 27.7 million for the year. So that effectively became the target, the control target that we tried to work towards for 24-25. Next slide, please. So with that target of 27.7 million, our financial performance in the annual accounts that was reported is a year-end deficit of 27.627 million. So we were just inside that forecast. Now, if you compare the deficits we had in 22-23 and 23-24, it meant that over the 3-year period, our combined deficit was 70.8 million, and therefore we didn't achieve the 3-year roll-in position of balance. So therefore, we failed both financial duties under section 1751 and 1752A. So we did not have an approved plan, and we did not balance over the period. Hence, the need to work within 1-year operational plans until we can restore that position. Next slide, please. This is just a financial summary, a tabulated summary of that position. So as we can see in 22-23, we were overspent by 26.7 million, overspent by 16.4 million in 23-24, and then that increased back up to 27.6 million in 24-25. Hence, the 3-year roll-in test that we have shows that we were 70.8 million overspent in that period. So, and again, aggregated, if you look at the the resource allocation in that period. It was 70 million against 4.1 billion, just to put some context on the level of that overspend within the level of allocation that we receive. Next slide, please. Just looking at what's in the annual accounts. The annual accounts are quite complex. They are a long read, a number of pages, perhaps up to close to 100 pages. But in summary, this is broadly where we receive our income from. The biggest slice on that left-hand pie chart is the Welsh Government allocations that came in of 1.497 million. But other significant funding sources are from our commissioners. The biggest commissioner being the Welsh Joint Commissioning Committee, which buys specialised services for the whole of Wales, tertiary and specialised services for all residents of Wales, and that placed contracts with us of 383 million last year. And then other LHBs also flow some of their patients to us outside the Welsh Joint Commissioning Committee contract of 100 million. And then we have also some trading income with health boards for lab services and so on and so forth. And we also receive a training grant from Health Education and Improvement Wales of 64 million. Our expenditure then, over to the right-hand pie chart, is about half our expenditure goes on staffing. The big staff groups are nursing and medical staff, as you might expect, but also significant other staffs in terms of laboratory staff, admin staff, porters, capital estate staff, healthcare support workers, and so on. We also have expend on primary healthcare services. Continuing healthcare is a big area of expenditure for us now, and we also buy healthcare from other providers for our patients that flow out. And then the other hospital and community expenditure would cover a lot of the estate's costs of keeping the estate and the operations flowing throughout our sites. Next slide, please. Just looking at one of the key drivers of our cost increase, and if we look from 21 to 22, and that left-hand chart shows the increase in staff, which has gone up by a couple of thousand in the last few years since the pandemic. A lot of the pressures and challenges Suzanne has outlined in her presentation around an aging population, a sicker population, and comorbidities that are within our population. It's not no longer it's just one condition. People presented with multiple complex conditions mean that in many ways our bed base has not decreased since the pandemic. It increased for the pandemic for the number of sick people that we were admitting, and we haven't been able to reduce that bed base as new demand has taken up the strain on the health board, and as a result, a lot of our staffing has had to increase by about 2,000 staff over this period to maintain and support the increased bed base and additional services within the health board. And just look at those staff groups. There's just a pie chart that gives some illustration of the staff groups that we have employed within our staffing establishment. Next slide, please. In terms of the assurance and the outcome, we had a new Wales audit team, Audit Wales, I should say, audit us each year, and we had a new team this year. It's a periodic changeover in teams. We work well with them. They brought us a fresh perspective and a fresh working practice, and to assure the meeting that the accuracy of the annual accounts can be taken forward by the fact that the work and the review that's carried out by the Audit Insurance Committee, subcommittee of the board throughout 24-25. There's work carried out by our internal audit and counter fraud teams throughout the year, and then there's the work that is completed by Audit Wales during the year, but especially at year end when they look at our financial statements. We submit draft financial statements very quickly after year end in late April, early May, and then there's a very tight work program carried out by Audit Wales to inspect our statements and dig into supporting documents to assure the accuracy of the statements, and they summarise their findings in what's called an ISA 260 report that has been reported to the board. And the accounts were then approved by the board on the 25th of June. We also give assurance in terms of our governance and management in something called the letter of representation, which we provide to Audit Wales. And then subsequently and finally, the accounts were approved by the Auditor General for Wales on the 30th of June. And that little blue box at the bottom says that an unqualified audit opinion was given on the accuracy. It's an accounting term, but we call it true and fair. And what Audit Wales were confirming is that the accounts that we prepared of the position, albeit it's a deficit 26.6 million deficit position, they were a true and fair reflection in financial terms of the operations of the Health Board in 24-25. Next slide, please. We also have something, so that's about what we call revenue in finance terms, the money that we have each year to maintain our operations. But we also have another allocation called a capital resource outturn, and that's to spend on, if you like, things, buildings, expensive equipment, IT systems, tangible assets. And we also have a duty to ensure that capital expenditure remains within the Welsh Government allocation over the same 3-year period. So very similarly to the revenue position, we're more success in this front, and that we did successfully manage our capital program, and we delivered a small surplus of 248,000 against our limit in 24-25 of 59.1 million that was set for us by Welsh Government. We also had a small surplus in 22-23 and in 23-24, and that means over 3 years our combined surplus has been £408,000, and that means that we have met the financial duty to break even against the capital resource limit over the 3 years 22-23 to 24-25. Next slide, please. So this table, similarly to the revenue, just confirms the position, and going to that total, what we're saying is that over a 3-year period, we have spent 159.761 million, which is just 400,000, and underneath what was allocated to us as a control total by Welsh Government of 169,000. Next slide, please. Just as a little flavour of what we spend some of our capital on in 24-25, upgrading and maintaining the estate is becoming an increasing proportion of what we spend on. Clearly, we would like to build new buildings and provide the best facilities we can to our population and our patients. But it won't have escaped anyone on the meeting that we do have an aged estate and a large estate, and the money that needs to be committed to upgrading and maintaining that and keeping that supporting patients is becoming more and more significant each year. So the largest chunk actually went on upgrading and maintaining the estate, but we did spend money on medical diagnostic and neuroradiology equipment. We have engaged in making the estate safe and actually decarbonisation and some of the solar programs that we are currently engaged in, which hopefully will also provide future savings and take a little bit of pressure off our revenue overspends. And again, in this IT world, we are having to invest more heavily in cybersecurity and renew a lot of the IT infrastructure across our estates. And then finally, IFRS 16 leases. These are technical terms whereby we would normally, in previous years, have spent money hiring equipment. Now, under new international capital accounting rules, we now count this as capital, and we require to allocate this as capital expenditure within the accounts, and 3.3 million of that is effectively hire of equipment where we will have the beneficial ownership over a period of time. In 25-26, looking forward, we continue to forecast the need to maintain and upgrade the estate. We will continue to improve the safety and the decarbonation program, and we will continue to invest in equipment and IT. Where we are able to flex some of our programs, that is where those fairly small figures on equipment and IT may increase during the year if we are able to flex our allocations accordingly during the year to see where we have opportunity to buy new equipment and replace aged equipment. Next slide, please. So looking out, we in 24-25, we're now going into 25-26. So we are still unable to submit a balanced 3-year plan to Welsh Government. And again, we have submitted in 25-26 a 1-year operational plan, which is currently projecting a £56.2 million deficit. This is noted by Welsh Government, but discussions are continuing with Welsh Government concerning how we can improve that projected deficit. That is a step up from the £27.7 million for outturn that I've just reported for 24-25. It is of concern to everyone across the board and senior management, and clearly of concern to Welsh Government. And we do continue to work closely with Welsh Government to see how we can improve that £56.2 million deficit. To meet that £56.2 million deficit, we do have to deliver £30 million worth of savings in 25-26. And at this present time, we have identified most of those savings, but we still have work to do to complete and meet that target. Next slide, please. Or is that the end? I believe that might be the end of the slides. Nathan, is that correct?
That's correct, Rob.
Okay, thank you for listening.
Thank you, Rob. Again, very complex set of figures for us to wade through there, but well presented, and we will look to that financial outlook as we go forward. With a lot of determination to reduce the financial deficit that we're currently dealing with, and we as a board, I know, are very committed to making every effort we can to reduce that deficit. Okay, before I ask the meeting to adopt the annual report and accounts, I'd like us to take the opportunity to field questions from the public. And in this section, I'm going to ask my colleague and Director of Corporate Governance, Matt Phillips, to read out the questions, and I will then invite executive members of the board to field those questions. So first of all, question 1, Matt, please.
Thanks, Chair. Yeah, so no name on this one, but the question is, why are long service awards on stop, yet money is consistently found for the capital estates and facilities team to have staff recognition awards and the like? It's appalling that money is always found for capital estates and facilities, and yet the rest of us can't get replacement printer cartridges, let alone long service awards.
Thank you, Matt. I think probably our Executive Director of People and Culture, Rachel Gidman, is best placed to field this question. Rachel, please.
Yes, thank you. Thanks, Matt, for the question. Firstly, I'd like to apologise to anyone who has had to wait for their long-term loyalty awards. Why that was, we were trying to streamline the process to make it easier actually for our employees to gain these awards, but also now we've been successfully procured those awards for the future. So I do apologise for the delay, but now that's reinstated and people are getting their awards. On the note actually about our capital estates and facilities team that have their sort of recognition awards locally, we've been assured that actually sponsorship and the funding for these awards is fully paid through gaining external sponsorship and the budgeted, so no budget is allocated to the recognition awards because this is fully sponsored. So yeah, that's the answer to that question. Thank you.
Thank you, Rachel. The next question, please, Matt.
Yes, Chair, no name on this one either. And simply, when are the Health Board going to take action to clamp down on staff taking advantage of sickness policies?
Thank you, Matt. And Rachel, I guess this falls within your portfolio as well. So over to you, Rachel, please.
Yeah, it does actually. We recognise this also. Suzanne's alluded to the brilliant basics, and actually sickness, absence and availability of staff is one of our focus, one of our brilliant basics for our workforce focus, because we understand that actually it has an impact on all staff. Staff who are off sick, but also staff that are actually working at that time. So what we've currently done, we've actually revamped the All Wales policy is the All Wales sickness policy. But what we've been able to do is look at our training to really support managers and our employees to be a little bit more directive. So it's actually fair and consistently implemented. We also have sickness panels because we actually can really drill down to our sickness data. And what we've also observed is that there are high levels of sickness in hotspot areas. So what we're doing is supporting the people team, is supporting the managers with sickness panels and really look at individual cases to really get people back into work or to support those who are off with the right intervention. Thank you.
Thank you, Rachel. Matt, the next question, question 3, please.
Yeah, this is coming from Nigel Coombs, who asks, with the utilisation of AI across organisations in the public sector. Why are minutes, particularly boards, so long? Minutes from private sector organisations are condensed into easy to read notes with actions. Wouldn't it be more productive to have shorter minutes across the health board? Something to consider right across NHS Wales.
Thank you, Matt. And I think probably, Matt, you're the best placed member of the board to field this question. So back to you, please.
Yeah, thanks, Chair. And I don't disagree, Nigel, to be honest. In fact, I have tried in a previous organisation to strip minutes right back to a simple bookmarked hyperlink to the recording and then listed actions and decisions. But in that case, it did fall foul of a subsequent audit. So that there is an appropriate length of a minute out there. I couldn't tell you exactly what it is, and board minutes are longer perhaps than I'd like them to be personally, but they are long in important meetings as well. So there's a proportionality piece here. It's not to say that we just accept that status quo. They're always looking for ways of making use of the technology that's constantly growing out there and make the best use of the systems that we already have. So we do hyperlinks within our minutes for the committees that will take you straight to the point in a recording where a topic was discussed. And in fact, our minutes are and have been for over a year now written with the assistance of AI, which has been done, with a concurrent kind of shrinking team, as you'd expect, given the financial pressures that we're facing. We look to make adjustments elsewhere in the organisation. Our strategic leadership teams, for example, basically do what you've described and capture actions and decisions. And I'd certainly look to see that roll across the rest of the rollout across the rest of the organisation. We share these practices across Wales, but yeah, fundamentally, I agree that there's scope to take this further.
Thank you, Matt, and thank you for the question, Nigel. I hope that goes some way to answering the query you've raised with us. Okay, Matt, the final question, please.
So this, again, I don't have a name, I'm afraid, but I'm writing to bring up a matter that's been a point of concern regarding communication about patient transfers and overall care, particularly in cases involving patients with diagnosed conditions such as dementia. Recently, a family member who's diagnosed with dementia experienced 3 separate moves during their stay. Unfortunately, during the first move, no one contacted the family to inform us of the transfer. This lack of communication resulted in him being diagnosed with further complications without any family member present to support him, leaving him unable to comprehend the information given. These moves contributed to his increased confusion and unwanted distress. To add to the concern, his final move was to ambulatory care in Lakeside. While I don't wish to cast a negative light on the health board, I must express that the environment was unpleasant. There was a noticeable accumulation of rubbish on the ward, a lack of staff, and it felt like this was not the most appropriate area for many of the patients. Given these experiences, I'm reaching out to inquire if there is a better plan in place for communicating with family members regarding patient transfers and care. Ensuring that families are well informed and involved in such decisions is crucial for the well-being of patients, especially those with conditions that affect their cognitive abilities. I'd greatly appreciate any insights or improvements that can be made to enhance communication and care for our patients and their families.
Thank you, Matt. And to whoever anonymously submitted this question, thank you very much. It is a patient experience story for us as a board to consider very seriously. And if you do wish to make yourself known in due course, we'd be happy to discuss the matters further with you. But in the meantime, I think the best board member to field initially the question is our Executive Director of Nursing, Jason Roberts. Jason?
Yep. Diolch, Chair and Board of Pawb. Thank you very much. And I just want to echo Chair, I would like to first formally apologise to any patient and relative of the patient. There's been an unnecessary moved around the hospital. Good communication is paramount, as we all know, to ensure that patients and relatives are kept up to date with any changes to their treatment plan or environment. And I'm clear that it's the responsibility of the whole clinical team to ensure that clear and concise communication happens. We have a number of initiatives across the hospital to care for our dementia patients. We have a programme of work specifically focused on dementia and the adoption of the All Wales Dementia Hospital Charter, which we've signed up to, which is specifically aimed at improving the hospital environment and care for people living with dementia and the communication with family and loved ones. We also have a specialist team, so what we're doing is we're trying to increase staff's awareness regarding dementia in the organisation. We've got a team called the Dementia Learning Development Team, who have experience, personal experience and professional experience of and knowledge of complexities of living with dementia and experience and what the relatives experience with a relative with dementia. All staff have the opportunity to book onto this course, and we're actively promoting it. And from February 2026, I'm pleased to announce that we've managed to get this development training schedule on the nursing preceptorship program, which means that every nurse that coming into the organisation will undertake this specific development. We commission, I think you mentioned the music therapy earlier on, that we help commission through and procure through our health charity, and we commission our mental health matters and our brilliant team of volunteers to provide meaningful activities for patients living with dementia while in the hospital setting. However, I agree that the movement of patients with dementia has the ability to increase their confusion. And whilst it's a challenge to maintain clinical capacity across the UHB in times of high clinical activity need, we are doing everything we possibly can to limit the multiple movement of patients within the health board, particularly dementia patients. We are kicked off an initiative called the Exemplar Ward, which fundamentally, it's regarding the environment of the ward and how that looks to patients, particularly with dementia, but also looks at the principle of ensuring that the patient goes to the right ward the first time to reduce those multiple moves. And I just want to echo, Chair, what you said at the beginning. However, I'm aware that this can fail on times, and I'm keen that we learn. So I would respectively ask the relatives if they want to make contact with me, can be confidentially if they want, so I can discuss their individual experience with them and obviously look into their situation further. Thank you.
Thank you, Jason. Thanks very much. Matt, I believe that concludes the questions from members of the public.
That's right, Chair.
Thank you. I'm going to move us on then, colleagues, to item 7 on the agenda, which is the adoption of the annual report and accounts. We've all listened to the presentations from Suzanne and Rob on both the accounts, the quality side of our reports, and the financial side of the reports. So are colleagues happy to adopt the annual report and accounts for 24-25? Thank you very much. For information, the Welsh translation of the annual report and accounts will be available at the Cardiff and Vale website by the end of this month. The easy read version of the annual report will be available on our website by the end of today. Okay, thank you very much indeed. Next item is the delivering of the plan. I'm going to pass over to Adam Wright, our Director of Operational Planning. Adam.
Thanks very much, Chair. So as Jan has outlined, my name is Adam Wright. I'm the Director of Operational Planning and Performance for Cardiff and Vale. I'm delighted to talk you through the plans the Health Board has for this year and beyond. So on the following slides, you'll see some of our key ambitions and areas of focus, which build on some of the highlights Suzanne shared with us earlier. Important again for me to set these plans and ambitions within the context that the Health Board is operating. Clearly not new to anybody, but I just wanted to remind ourselves of the environment we're working within. So you can see here, as we've already seen, that notes in a financially challenged position, which means we have to make significant cost savings this year and in future years. That comes against a backdrop of increasing demand. Our modelling actually indicates urgent and emergency care pathways are forecasted to be between 3% and 4% busier this year than they were last year. We have made strides to reduce waiting times, both across urgent and planned care, but we do know that many patients still wait far too long to receive the assessments and the treatments that we want to deliver. And as has been mentioned, we know a big part of how we need to change is delivering more care closer to our patients' home and out of hospital where it's appropriate to do so. So moving on to how we will deliver. Clearly, delivering healthcare for a population the size of Cardiff and Vale is complex. And within the service delivery context that I work in, we have a few guiding principles that are helping us to deliver the best services we can over the coming year. Productivity and efficiency features heavily, and with the context mentioned on the previous slide, it's going to be incumbent on us to do things more efficiently, and we have the recommendations from the Ministerial Advisory Group on Performance and Productivity to help us focus our efforts. Similarly, there are a number of enabling actions put forward by Welsh Government, which again give us some key actions which will help deliver our agenda. These are across clinical pathways, but they also cover areas such as making financial and workforce improvements. Thinking about that ambition to move care closer to our patients' home and out of hospital, we are busy getting the foundations laid for transforming ourselves into an integrated community care system, an ICCS. As you've seen, this is a key part of our strategy as part of the delivering in the right places, and it means we need to take steps to fundamentally change the way we deliver care. In practice, ultimately, that's increasing the percentage of resources that are spent in primary and community care and making sure we have coherent and skilled collection of services to give our population the care they need in the right place. Finally, on this slide, we must ensure that quality is at the heart of all we do, and our clinical teams have this as their absolute focus. This is supported by our quality programme, which is putting the spotlight on some key areas this year, including infection prevention and control. And as Suzanne has already mentioned, we have that ambition to eradicate avoidable harm at the forefront of our plans. So moving on to timely access to urgent and emergency care, the remaining slides I'm going to share with you really details our ambitions across some of the key pathways. And in this area, one of our key ambitions is to reduce the number of patients who are in hospital when they don't need to be, known as pathway of care delays, and that will help reduce our overall length of stay. Improving continuity of care so that patients can expect the same high standards of oversight and care no matter when or where they access services is a key priority. We know that the outcome of making improvements to urgent and emergency care, whether that is in the emergency departments, on the ward, or in any part of our system, will be safer, higher quality care, which ultimately costs less in the long run and is better for patients. As we move forward to think about the next slide and timely access to planned care, this is a focus right across the pathway, from initial referral through to discharge and ongoing support. In outpatients, we know that too many people are booked for appointments who don't then attend, and we think that improving our do not attend rates or our DNAs gives us an opportunity to see around 3,000 more patients per year. We also know that waiting times in Cardiff and Vale are far too long for diagnostics, so we do have plans in place to get ourselves back in line with the 8-week standard, but that requires a big focus in areas such as endoscopy and non-obstetric ultrasound. Our Theatres Together programme has been established to transform the way our operating theatres run for patients and staff. Through this ambitious programme, we will aim to make the best use of our resources, developing a strong and safe leadership culture, and to support our staff to deliver the exceptional outcomes for patients. Finally, on planned care, we know the location of where we deliver from needs to continually evolve. So for us, that includes doing more at our surgical hub in Landock and working with our partners across South Wales as more options become available, including the plans to develop Clantryston Health Park. I've already described how building community capacity is a central part of our plans and how the ICCS is our big push this year. So I won't dwell too long to avoid repeating myself. But beyond the ICCS, we are also transforming our community care in mental health, which you'll see on a future slide, as well as continuing to drive performance in areas such as primary care, dental, pharmacy, and optometry. We're working hard in these areas to deliver these new models of care because ultimately we know they will improve access and reduce waiting times for our patients. We know that partnership working is imperative in this space, and continuing to better integrate with our partners across local authorities, the Welsh Ambulance, the third sector and beyond will be absolutely help deliver better outcomes for our communities. Moving on to mental health, transforming services remains a key focus for this year, and our aim is to build on the work we've already done with our community mental health plans, which ultimately is to get better coordination between primary care, mental health and community care. Inpatient safety is also an ongoing priority as we look to make a number of changes to make our environment safer and more secure for patients and for our staff. We know that due to demand and capacity challenges, too many Cardiff and Vale residents are placed out of area and therefore they're receiving their care too far away from home. So this year, that pressure is again increased, but our team are focusing on delivering improvements and new models that can reduce it moving forwards. And a big part of our plans for mental health is to improve our estate. We know that some of the places aren't as therapeutic as we'd like them to be, but it is important that we can't undertake that estate transformation without having a solid and agreed clinical strategy on which to base it. So our teams are busy developing that and that longer term direction of travel. Moving on to population and prevention, making meaningful and sustained changes to the health of the population is an absolute cornerstone of our organisational strategy. For this year, that means continuing our drive on some priorities, which we know, if we do improve them, can dramatically reduce the health inequities within our communities. That's vaccination, obesity, including diabetes, and smoking. They all remain absolute focus areas with ambitions to improve our performance metrics across each of these by the end of the financial year. We're also committed to redoubling our efforts on communication through the Making Every Contact Count initiative, as well as striving for improved coordination and access to women's health services. And the introduction of a women's health hub by the end of this year is a key part of that plan. Finally, moving on to quality, as I said at the beginning, delivering consistently high levels of quality and outcomes is ultimately what we're striving for. We know we deliver exceptionally high levels of quality care every day, but we also know that those levels are not as consistent as we would like them to be. Improving patient experience, outcomes, and delivering value-based healthcare is an absolute must for us this year. And by value-based healthcare, that means the services and outcomes that matter to our patients and that provide a benefit to wider communities in a cost-effective and efficient way. Of course, we know it's our fantastic teams, whether that's clinical, operational, corporate, and support areas, who are central to delivering this care. And we're therefore committed to both supporting and empowering our teams to continue to do the best for their patients, while also developing and valuing them to improve our staff morale and well-being. So in summary, I hope you can see we've got an ambitious plan in the year ahead with a real imperative to make productivity and efficiency central to our delivery. The financial environment we're operating in does present a challenge, but also an imperative for us to focus on delivering best practice to get patients the right care in the right place, which we know will ultimately be most cost effective. Our plans for developing our integrated community care system need to move at pace to deliver on our strategy, and we must continue to support our teams and deliver exceptionally high levels of quality care. Thanks very much, Chair.
Thank you, Adam, and thanks for the insightful look forward and identification of the challenges that we face in the year ahead, but also the challenges that we as a board are determined to rise to and resolve. It's very important, as you emphasised, Adam, that we put patient safety and quality of service as the #1 priority for the board, but also the well-being of our staff, as you reflected, because the work they do for us is absolutely fantastic, but they are under pressure, and we must recognise that and take care to look after them. So thank you, Adam, very much indeed. We're going to move on now to a video of our year in review covering 24-25. Nathan, if you can start that when you're ready, please. Are we having a problem, Nathan?
Bear with me, Chair. It's playing elsewhere.
Well, I have to say that Suzanne was a complete surprise to me, and I'm ever so grateful to all of you for the amazing support you've given me during my term of office as chair of Cardiff and Vale, which has been an absolute privilege and a pleasure. I hope I'm not too emotional, but I must carry on with the meeting today, but that was quite a surprise and unexpected totally. I hope you all enjoyed the year under review, an excellent video, but I do understand that some saw it at a different pace to others. So my apologies, please, to everyone for that slight IT glitch. The video now brings us to the close of another annual general meeting, and I do hope you've enjoyed the meeting and found the content informative. My thanks to each of the presenters today for providing us with a very comprehensive overview, and to those of you who are watching remotely. The year in review video and annual report will be available on Health Board website very shortly, the links for which will be provided by my communication colleagues in the chat section for ease of reference. As this will be my last annual general meeting, as Suzanne has alluded to, as chair of Cardiff and Vale University Health Board, I would like to sign off by reiterating my sincerest thanks to everyone across the organisation for the honest and genuine endeavour you've all made to provide the best possible care to the population we serve. You've been magnificent. I can't emphasise that enough, so thank you all very much for that. It truly has been a fantastic opportunity for me to be part of such an incredible journey with Cardiff and Vale UHB. I would like to wish you all the best of luck and every success for the future. Thank you very much. Hwyl fawr.